Welcome to the Omni Dental podcast. Right now, in your mouth, there is likely a piece of engineering you paid hundreds or maybe even thousands of dollars for.
Yeah, that's almost a guarantee for most adults today.
Right. And every single time you chew, swallow, or, grind your teeth in your sleep, you are putting that expensive investment through a microscopic earthquake.
It's intense.
Yeah.
We really tend to treat dentistry like it's just this permanent fix.
Exactly. Like you break a bone, it heals, you get a cavity, they drill it, they fill it, and boom, problem solved forever.
But that's just not how it works in reality.
No, it's not. So today, our deep dive is looking at the harsh reality of dental restorations. Basically, we want to figure out how to actually keep your expensive dental work from failing prematurely.
Which is honestly one of the most expensive misconceptions in modern healthcare.
Oh, for sure.
I mean, we walk out of a clinic with a brand new porcelain crown, right?
Yeah.
Or a fresh composite filling.
Mm-hmm.
And because it feels as hard as a rock, we just assume it's completely invincible.
We totally do.
We don't realize that the human mouth is actually one of the most dynamic, hostile, and just outright destructive environments in the entire body.
Yeah, it's a war zone in there. And to get to the bottom of the physics and the biology happening in your mouth right now, we are pulling directly from materials provided by Omni Dental of Arlington Heights.
They provided some really fantastic resources for this.
They did. We've got their comprehensive clinic guidelines and a heavily detailed guide authored by Dr. Bylis Poles.
Right, and Dr. Poles has been doing this for over a decade.
Yeah, handling everything from routine checkups to really complex dental emergencies. So whether you're listening to this with just a single tiny filling from when you were a teenager, or maybe you have a mouth completely full of modern crowns and bridges.
Which is super common.
Right. Understanding the actual mechanical lifespan of your dental work is the ultimate shortcut. It is how you save your wallet, and honestly, more importantly, how you avoid waking up in absolute agony.
Absolutely. But, before we even map out how these restorations break down, we really have to look at how they were built in the first place.
Okay, let's unpack this.
Yeah.
Because looking at the scope of what Omni Dental does, comparing them to a traditional old-school dentist's office feels almost entirely inaccurate.
Yeah, it's like comparing apples to, aerospace engineering.
Seriously, it's more like looking at a high-tech engineering firm that just happens to specialize in the human mouth. They aren't just using the standard mirror and probe anymore.
No, not at all. They heavily emphasize advanced diagnostic technology to really map the mouth.
And they do full arch restorations, all-on-4 dental implants. They even fit custom sleep apnea appliances. Oh, and they operate as an environmentally conscious practice, too.
Right, which means minimizing waste without dropping their clinical standards whatsoever. It's a brilliant synthesis of modern medicine and modern ethics.
It really is.
But look at this from a purely mechanical standpoint for a second.
Right.
People are driving across 5 or 6 different city lines just to reach their clinic at 305 East Rand Road in Arlington Heights.
Yeah, their service area is huge. I mean, they're pulling patients from Buffalo Grove, Palatine, Mount Prospect,
Rolling Meadows, Schaumburg.
Wheeling, Des Plaines, Elk Grove Village. It's massive.
And they are doing that because the technology required to map a mouth accurately is incredibly specific. When Dr. Poles and his team are placing a crown or mapping out the trajectory of a titanium implant in your jawbone, they are dealing with fractions of a millimeter.
So wait, if the mapping is off by a hair, what actually happens? I mean, does it really matter that much?
No, it changes everything.
Really?
Yeah. If the diagnostics are even slightly off because a clinic is using outdated low-resolution imaging, the final product is going to seat differently. And in the hostile environment of the human mouth, slightly off isn't just an inconvenience.
What is it then?
It is a ticking time bomb. The bite will be uneven, the margins won't seal properly against the natural tooth, and the whole structure is just compromised from day one.
Wow. Okay. So a comfortable, hyper-precise baseline isn't a luxury. It is the fundamental requirement for longevity.
Exactly. If your current dentist feels kind of outdated, they might actually be missing the technology needed to ensure treatments are efficient and precise.
But if mapping a mouth requires that level of aerospace-grade precision, it kind of begs the question, why do these perfectly engineered restorations ever fail in the first place?
Right, because they do fail.
Yeah, like if Omni Dental installs a flawless crown, it doesn't just randomly pop out on a Tuesday afternoon for no reason. Right?
No, it takes active, continuous force to destroy these materials. Dr. Poles' guide outlines that crowns and fillings have a natural lifespan. But when they fail prematurely, it is almost always a localized environmental issue within the mouth.
Like what? What's the main culprit?
At the absolute top of the list is gum disease. We have to remember that a crown isn't just floating in space.
Right, it's anchored to you.
Exactly. It is mechanically bonded to your biological tissue. Gum disease periodontitis. It literally eats away the underlying bone and the soft gum tissue holding the foundation of that tooth in place.
Okay, so think of a top-of-the-line dental crown, like putting a brand new $500,000 roof on a house.
That's a good way to look at it.
Yeah, and if the foundation of that house, which is your gums and your jawbone, if that is actively rotting away from periodontal disease, that beautiful new roof is going to collapse long before its warranty expires.
Yeah, that is a spot-on analogy. You are losing the structural integrity completely underneath the restoration.
But it's not just the foundation, right?
No, the source material points to grinding your teeth, bruxism, as another massive mechanical culprit.
So keeping with the house analogy, imagine if, on top of a rotting foundation, that beautiful new roof was also being subjected to a localized, violent hailstorm every single night while you sleep.
A hailstorm of your own teeth.
Right. The materials are strong, sure, but they just aren't designed to take a beating like that 8 hours a night.
What's fascinating here is this physics problem actually explains the phenomenon of repeated dental failures.
Oh, like when someone keeps breaking the same tooth.
Exactly. You hear people complain all the time, saying things like, my dentist must have used cheap glue. This same crown is broken 3 times in the last 5 years.
Yeah, I've definitely heard people say that.
Well, according to Dr. Polz's insights, if a patient keeps shattering a crown, it is almost never a string of bad luck. It is an underlying mechanical error.
Because of the uneven bite.
Yes. If your bite is uneven, you are effectively putting thousands of pounds of microscopic pressure on one specific, highly concentrated point of porcelain every single time you chew.
Wait, hold on. Shouldn't the body naturally adjust for that?
You would think so, right?
Yeah, like if a crown is a millimeter too high, why doesn't the jaw just adapt its chewing motion instead of systematically shattering the tooth over the course of a year?
It's a highly logical assumption, but it fundamentally underestimates the brute force of the human jaw.
Really? Is it that strong?
Oh, it's incredibly strong. The masseter muscle, the main muscle that closes your jaw, is one of the strongest muscles in the human body relative to its size. Yeah, it can exert up to 200 pounds of force on your back molars. So when you chew, your jaw operates like a class 3 lever. It doesn't delicately step around a high spot. It powers right through it.
Ouch. So if a crown sits just a fraction of a millimeter too high.
All that 200 pounds of force concentrates on one microscopic point instead of distributing evenly across the whole tooth surface.
Yeah.
It's just systematic destruction.
So the dentist could put the strongest material known to man in your mouth, and your own jaw would still find a way to obliterate it if the mechanics are wrong.
Without question. The source is absolutely adamant about this. Fixing the root cause, whether that is managing the nighttime grinding or adjusting the occlusion, the bite is the only way to stop the cycle of repeated failures.
Otherwise, you are just throwing thousands of dollars into a wood chipper.
Pretty much. And poor oral hygiene and skipping your routine checkups round out the list of culprits, entirely because they allow these destructive, invisible forces to operate completely unchecked in the dark.
Okay, so if ignoring these invisible forces turns a minor issue into a shattered crown, how much control do we actually have over catching a failure before we wake up at 3 a.m. in excruciating pain?
A lot more than people realize, actually.
Really? What are the actual physical warning signs our mouths are giving us?
Well, the body's always communicating, but the signs of dental failure are incredibly subtle early on. According to the Omni Dental Guide, the sensory red flags usually start with pain or pressure sensitivity when you bite down on a very specific tooth.
So it's not a generalized dull ache across your whole jaw.
No, it is highly localized.
And it doesn't just have to be pain either. The source mentions tactile red flags too.
Right, things you can actually feel.
Yeah, like you might feel a rough edge where there used to be a smooth surface, or suddenly notice a tiny gap catching your tongue, or maybe catching the floss when you clean your teeth.
And that tactile change means the margin of the dental work is breaking down.
The margin is the gap, right?
Yeah, it's the microgap where the artificial material meets your natural tooth structure. And another major visual cue is a dark stain forming right around that exact edge of a filling or a crown.
See, here's where it gets really interesting, though. If you look at that list of symptoms, a slightly rough edge, a little sensitivity to cold water, a dark shadow near the gum,
Yeah.
None of these warning signs are immediate life-threatening emergencies, and that is exactly why people ignore them.
Oh, human nature totally kicks in,
Right. We just say, well, it only hurts a little bit. When I eat almonds, I'll just start chewing on the left side of my mouth.
which is the worst thing you can do.
Exactly. But the source material completely eviscerates the economics of dental procrastination. Why is waiting a few months so catastrophic?
Well, we have to look at what is happening on a biological level
Huh.
when that margin fails, that dark stain you see. It isn't just a simple discoloration or a coffee stain.
What is it?
It is literally the shadow of microscopic bacteria pooling in a tiny trench between the porcelain and your tooth.
Oh, gross.
Yeah. When you feel a rough edge, you are witnessing a breach in the seal. The cement is washed out, and a microscopic superhighway has opened up right into the tooth.
So it's like having a high-tech bank vault with a 3-foot-thick solid steel door, but accidentally leaving the air vent wide open.
Yeah, exactly.
The physical crown, the steel door, is impenetrable. The bacteria don't even try to go through it. They just walk right around it through the broken margin.
That is a perfect analogy. They bypass the incredibly hard protective enamel entirely, and they march straight into the dentin.
And dentin is soft, right?
Very. Dentin is the layer of tooth underneath the enamel, and it is significantly softer and more porous. Once the bacteria get in there, they secrete acids that eat the dentin away at a terrifying speed.
So it decays from the inside out.
Yes, completely hidden beneath the protective shell you paid so much money for.
Wow. So by the time that subtle sensitivity turns into an actual throbbing toothache, the inside of the tooth is just hollowed out.
Unfortunately, yeah. The damage is already severe by the time the nerve actually feels it. And this is where the economics of it really hit home.
Because waiting makes it worse.
Much worse. Regular checkups exist specifically to catch the broken vault door before the robbers get inside. A highly trained dentist, like the team at Omni Dental, uses their advanced imaging to spot that microscopic breakdown before you feel even a hint of pain.
Catching it early is the difference between a simple $100 adjustment, like maybe they just smooth an edge or patch a tiny margin, and needing a massive multi-thousand-dollar full replacement, a root canal, or even a complete tooth extraction.
Right.
Ignoring a tiny rough edge is the ultimate compounding interest, just in the worst possible way.
It really is. The financial penalty for waiting is entirely exponential.
Which naturally forces us to look at our own daily habits. We all know the basics. We know we are supposed to brush and we know we are supposed to floss.
But we usually do it wrong.
Right. Dr. Polz's guide highlights a mechanical error that most people make when they are maintaining their dental work.
This is such a critical nuance in the text. When people brush a crown tooth, they often just scrub the porcelain. But the hardware itself isn't what's going to decay.
It's the gap again.
Exactly. You have to specifically angle the brush and the floss to focus on the gum line around the dental work. You aren't just cleaning the tooth, you are actively protecting the biological gasket that holds the hardware to your body.
If the gasket fails, the whole engine floods.
Precisely.
Okay, next up on the prevention playbook. If you grind your teeth, you must wear a night guard. We talked about that localized hailstorm effect earlier. Well, the night guard is your protective shield.
It absorbs the 200 pounds of force so your porcelain doesn't have to.
And finally, a strict behavioral rule straight from the clinic. Absolutely never chew ice, do not chew hard candy, and please stop using your teeth as tools to open plastic packaging.
Oh, ice is particularly devastating, and people do it all the time.
It's so bad for you.
It really is.
Yeah.
When you crunch down on ice, you are combining two highly destructive forces.
Yeah.
First, you have extreme thermal shock, which causes micro-expansions and rapid contractions in the dental materials.
Right.
Second, you are applying intense, focused mechanical force onto a brittle substance. It is the absolute perfect recipe for fracturing a porcelain crown or cracking an old filling right down the middle.
Those are the non-negotiable rules. But what I appreciate about Dr. Polz's guide is that it also takes the time to wade into the murky, confusing waters of internet advice.
Oh, there's so much bad advice out there.
So much. It really helps to debunk some highly persistent dental myths. Let's look at the 3-3-3 rule. You see this all over social media right now.
Oh yeah, people are treating it like it's an undeniable medical law.
It's everywhere. The idea of brushing 3 times a day for 3 minutes at a time within 3 minutes of eating a meal.
Yeah, and the expert consensus in the source material is very clear on this. This is not an official, scientifically mandated clinical protocol.
It's just a catchy slogan.
That's literally all it is. It is a memory aid. While it might be helpful for a child trying to build a new habit, It is absolutely not endorsed by professionals as the standard of care.
Wait, can it actually be harmful?
Yes. In fact, brushing obsessively 3 times a day, especially immediately after eating acidic foods when your enamel is temporarily softened, can actually wear away your protective layers faster.
Wow. Okay.
Thoroughly brushing twice a day and cleaning the margins correctly is significantly more effective.
Good to know. Now, what about the 2-year rule? Because if catching a lifted margin early is so incredibly crucial to saving your tooth, why are so many people convinced they only need to see a dentist every 24 months?
Well, this is a classic, dangerous misinterpretation of public health data. The 2-year rule is occasionally cited in literature as the absolute outer limit, the red line of how long a human being can possibly go without professional dental intervention before severe, highly irreversible calculus buildup and structural decay take permanent hold.
So it's a boundary of danger, not a lifestyle recommendation.
Exactly. You wouldn't wait until your car's engine is actively smoking before you decide to get the oil checked.
I hope not.
Right. So Omni Dental, along with the broader medical community, steadfastly recommends the standard 6-month checkup for the vast majority of patients. You physically cannot catch a failing margin early or monitor the microscopic wear and tear on a crown if you only allow a professional to look at it every 2 years.
So what does this all mean? It means you have to be an active, highly disciplined participant in your own care, but more importantly, you have to have a dentist you actually trust to monitor these micro changes.
Absolutely.
The source finishes up by outlining the red flags of a bad clinic. How do you even know if you are sitting in the right chair?
The 2 metrics they highlight are transparency and time. The guide explicitly warns that a major red flag is a dentist who recommends highly complex, expensive treatments that you do not understand.
And they don't explain them.
Exactly. They make absolutely no effort to explain the clinical why behind them. Furthermore, if a provider refuses to show you the physical evidence, like the x-rays or the intraoral camera pictures, to actually support their diagnosis, you should immediately walk away.
It is your body and your bank account. You have a fundamental right to see the evidence of the failing margin before you agree to a $2,000 replacement.
It is a non-negotiable right. And the last critical red flag is a clinic that constantly rushes your appointments.
Because precision takes time.
We established earlier that good dentistry requires aerospace-level precision, right? Precision inherently requires time. A provider who rushes through an exam is a provider who misses the subtle, microscopic signs of a failing crown until it's too late.
That makes total sense.
A high-quality practice, like the ethos described at Omni Dental, doesn't rush. They welcome your skepticism, they welcome your questions, and they actually take the time to explain the physics of what is happening in your mouth.
Which brings this entire deep dive full circle. Good oral hygiene, keeping your 6-month appointments, and partnering with a highly transparent, technologically advanced clinic isn't just about keeping your natural teeth white for family photos.
No, it's so much more than that.
It is the literal insurance policy on every single piece of dental engineering currently sitting in your jaw. If you are protecting the biological foundation and you are actively managing the brute force mechanics of your bite, those investments aren't just a temporary fix. They can last for decades.
It really requires a total paradigm shift on our part. We have to move from a mindset of reactive pain management waiting until something shatters to a mindset of proactive biomechanical preservation.
So, to put this all into action for you listening right now, run your tongue along your teeth. If you have felt a slightly rough edge recently, if you are noticing a strange little twinge of sensitivity when you drink your morning coffee, or if you simply haven't been in for a checkup in a while and want a second set of highly trained eyes on your old fillings, do not wait for the bank vault to get completely hollowed out.
Please don't wait.
The team at Omni Dental of Arlington Heights is ready to help you map your mouth. They are open Monday through Friday from 10 a.m. to 6 p.m. You can reach out to them directly by calling 847-483-8833, or you can visit them online to easily book an appointment. Taking a closer look at a tiny problem today is the absolute smartest investment you can make to protect the massive investments you've already made.
It is the ultimate preventative measure, honestly. Yeah. And, if we connect everything we've talked about today to the bigger picture, it leaves us with something quite profound to consider.
Oh, what's that?
Well, we just spent this entire time dissecting how repeated dental failures are caused by an uneven bite, how putting a tiny microscopic amount of repetitive pressure on one isolated area can systematically destroy a piece of hardened manufactured porcelain over the course of thousands of meals.
Yeah, the sheer physics of it is incredible. 200 pounds of force finding the one weak link.
But this raises an important question that extends far beyond just dentistry. If a bite that is mechanically off by just a fraction of a millimeter can generate enough localized destructive force to shatter solid porcelain,
Yeah.
how much of our broader physical health is being shaped by forces we can't see? Think about our chronic tension headaches, our unexplained neck pain, or, the subtle jaw tension we wake up with every single morning.
Oh, wow, yeah.
How much of that is being dictated by invisible micropressures in our bodies that we simply accept as normal day after day until something inside of us finally breaks?